Hello, Healthcare Experience Matters listeners. We're back with another episode, and this time we are joined by Dr. David Ezon. He is a pediatric cardiologist and associate professor of pediatrics with Mount Sinai Hospital in New York. He's also the creator of the Patient Empowerment Workshop series, as well as the author of the book Survive and Conquer: Your Guide When Illness Strikes. We're also joined today by Katie Owens, who will be moderating today's discussion. She's, of course, the president here at the Healthcare Experience Foundation. And Robert Eisinger is joining us as well, Chief Administrative Officer at HXF. Katie, I'm going to pass the microphone over to you. And I know you have a lot to talk about today, so I'll let you take it away.
Oh, thank you, Casey. Hello, everyone. Dr. Ezon, thank you so much for joining us today. It's such a privilege to finally get you on Healthcare Experience Matters.
Thank you very much for having me. It's a pleasure.
I'm wondering, would you share a little bit about your background for our listeners so they can get to know you and hear your story? It's so powerful.
Oh, well, sure. I grew up in the shadow of medical illness, in my dad in particular. And he was really the beneficiary of cutting edge technology. And in that, we kind of worship doctors and we see them as these people that can provide such wellness to people and bring miracles. And at the same time, a really healthy skepticism. And so when I went into medicine, I really try and bring that in the room with me. I always joke, I put my mother in the room, so she wouldn't tolerate any nonsense from the doctors. And I try and make sure I remember that when I'm with my patients. And so as a pediatric cardiologist, I really do get to see the lighter moments, but also the more difficult challenges that we face. And through those frustrations from both sides, I've kind of made that my career path forward to help patients and families.
Wonderful. And I just think that's so powerful. And, so oftentimes we hear there's a disparity where, we want to give the care that we would offer to our loved ones and something gets in the way. And I just think that's such a powerful habit that you've established every child, every family, every time.
That's right. Yeah. From the physician aspect, it's really about removing any holier than thou attitude and realize that we're really in the mud together. And sometimes saying that exactly, there's a balance because patients will look to the doctor and we need to take that role as well as a leader. But there are times where the doctor needs to be a follower. And that's the balance that from the medical aspect, we have to remember when we walk in the room with a family to say, as I say, I can be the guide on the trail, but you have to tell me which trail we're going on. I can help you get through this difficult moment, but you're going to set the direction, not me. And you're not the same as the last patient I just saw, the last family I just saw. So what is it that you have that you want to bring to the table to help me help you?
So powerful. And so tell me, I know you mentioned that you grew up in a family where your dad was ill. What made you become so passionate to make this next journey after such an already accomplished career as a physician? What inspired you to make that leap to help families and patients advocate for their own care?
The trigger was definitely the patient side of things. My cousin went to the emergency room and they made a slight medical error. And because of that, he had to have an invasive procedure and 6 weeks of antibiotics that he actually probably didn't even need, but they didn't know what to do. And so that's what they did. And when I found out, I slammed the phone down and I was just so frustrated. I was like, if I was standing next to him in the emergency room, there was no way they would have made that error. I wouldn't have let them. It was very simple. And I went for a run, and by the time I came back, the table of contents for the book was written. And those moments that when you feel the passion inside of you burning, that you know that there's something there. That if only I just wanted to be the guardian angel, And so that's what the book is. It's your guide. It's your guardian angel to help remember that these are wonderful people that are trying to help you, but they also need the patient's help to help them, to remind them. And then the workshop is an extension of that. I had the privilege of being invited to speak at an event led by a patient support group, which was a medical conference for patients where they talked about certain diagnoses in detail. And I thought, this is wonderful, except I would do it very differently. We don't need to know about the latest research exactly. What we need to know is that how to bring patients to the table so they can be equals. What are the skills that they need to cope with medical illness just for their own self, but also how to talk with the doctors and the nurses and the healthcare staff broadly in a way that elicits better care. And we can do that. We absolutely can do it now. I've seen it in person. And so there again at the conference, I just started jotting out, how are we going to make a medical conference for patients, a workshop for patients and families? And that's what brought all this about.
So, you mentioned reducing the power dynamic. What are some of the things that you say interpersonally in the exam room or in the ER when you're consulting that you help those families find their voice? I know that's something a lot of physicians ask us about.
Right. The biggest impediment, I would say, is confidence from the patient's end. The biggest impediment from the doctor's end is overconfidence often, and then just being overwhelmed often by other things. But from the patient's perspective, time and again, they have taught me and expressed to me, they often lack the confidence to ask the doctor a follow-up question, to counter the doctor, to consider a second opinion. And it's both because they want to be respectful of the doctor, but because they also may feel insecure. Well, this person's been to school for a dozen years. What the heck do I know? And what we do know is that the patient has a unique perspective to contribute, and that's not flattery. It's that there are certain insights that no doctor will have an understanding of, and so one of my challenges is to bring confidence along with a practical skill set to the family member to say, first of all, you have permission. You have my permission today to ask that follow-up question, to say, what about? But then also, here are the words you can use. Like, these are the exact words you can use to introduce this in a way that's both respectful, but affirmative, and strikes that balance. And what that does to the medical community is fascinating. It triggers us to act differently. There are certain patients that before we walk into the room, the patient doesn't know this, the door is closed. We take a big breath and we prepare ourselves because this patient is going to ask us the hard questions. We're going to look up that extra paper just in case we get, pimped, as we say in the medical community, ask that tough question. And so when we can teach families how to be more forward and take their seat at the table, it will elicit a different response. And that's what's going to get these families the VIP care that we talk about at the Patient Empowerment Workshop.
When you talk about confidence from a patient's perspective, I think of it in two ways. One is the one you just mentioned, oh, that doctor has so much more knowledge than I. But I also think of it as a vocabulary-focused lack of confidence. They're using words I don't understand.
That's right.
What does idiopathic mean? A dentist who says you got a cavity means you got a hole in your tooth. But when they start talking about other things, so maybe what do you share with patients about gaining the confidence to say, I don't know what you're talking about, or what could you say it again in a way that makes sense to me?
You're 100% right. So one of the first things we do is we talk about how, the patient is not dumb, but the patient is ignorant. And the difference between dumb and ignorant is if I fly to Rome tomorrow, I have no idea what anybody's saying. I don't speak Italian. It doesn't make me any dumber. I don't understand the language. I have no idea what's happening because I am ignorant of that dynamic, of that language. And so the first thing to do is to embrace that and say, yes, of course I have no idea what idiopathic means. Rather, it's your job as the doctor to bring me in and either speak in my language, or to teach me your language, as the case may be. No different than I should expect that if the doctor speaks to me in Italian, he should expect me to understand him. And so we talk about specific things like saying, explain it to me like I'm a 5-year-old, which is a nice way of a little bit humorous way of helping the doctor understand that he's really got to take this down and bring this a challenge to the doctor to do that. And another tip we use, for example, is just selective use of a pause. So if one were to say, okay, I hear you, doc, so we're going to go to the hospital for the hip surgery, and then what happens? And then just try and say nothing. Because the idea is we want patients to be able to visualize every single step along the way, beginning to end. That's how we set expectations and reduce surprises. And so by repeatedly saying, okay, and then what happens? It kind of forces the doctor into this dynamic where they have to go through things step by step. And then we get clarity. And with clarity comes trust and understanding, so that when something does go sideways, as unfortunately it often does, as medicine is unpredictable, we at least set our expectations and know that this was a possibility. And that's how we kind of build that conversation.
I know we've talked quite a bit, even prior to today's conversation, around your patient empowerment workshops. And one of the things that I keep coming back to is, for every organization and for everyone listening that has a patient and family advisory council, there are some really important tools to help onboard patient and family advisors by extending those transferable skills that you've identified in your patient empowerment workshops. Can you talk to us a little bit about how you focus that time and energy to really upskill these families and patients that are really committed to making healthcare better, not only for themselves, but also by contributing to these types of councils and committees within hospitals and health systems?
Yeah, thanks for that question. We've got a really tremendous response from Patient Family Advisory Council members in particular to the series. And I think it's because they're the transition between, the hospital system and the actual community. And if used correctly, these persons are force multipliers because they're the ones that can become the army that a hospital can use to elicit from the community this untapped resource of educated, confident families who can work hand in hand with the medical community. And to those that are, whose primary focus is safety, for example, in the hospital, I think they would see this as a real truth that often the doctors kind of think in a specific direction going straight, and we need someone to jump in front of us and say, wait, we need to take a pause. And besides the nursing staff, and the pharmaceutical staff, that's actually the patient staff. We should think of them. And so by training PFAC members in this skill set of how to deliver a history in a way that the doctor can understand and how to elicit expectations from the doctor, they can go out into the community then, and that can be their mission, is to educate families. And the other side of this is not just between actually the patient and the hospital, it's actually between the patient themselves, their family, and their community. And so PFAC members can be particularly useful in softening the edges of disease and of the harsh medical system by giving specific practical skills to families they encounter of resiliency and grit. Very much things that can be taught and passed on in 5-minute intervals, with this just touchstones that we have between these members and the community.
And I think that's so important when we work with organizations and their PFACs. They're such a gift of perspective. And what I just find so powerful is your emphasis on that upskilling so that they can speak the language and they can assimilate and they can have the presence that grabs the attention of the physician, the provider, the clinicians, and that just helps their voice carry forward.
Right. By giving them the skill set and then the confidence and then the permission to say, you're not just here just to make nice to the community and say we're doing this, but actually we need somebody, this is all hands on deck. And so let's give you this specific skill set that you can take forward and address this area of need that frankly we can't, because there is a dividing line sometimes, and we need your perspective to inform how we have this conversation with the community. And so I would say there absolutely is a path forward to as you say, to upskill these individuals, bring them onto the team in a way that we find really, really useful, that we can start to rely on these people to partner with.
So I know we've talked about confidence as a top barrier. What would you say to health system leaders, physicians, clinicians as the second biggest barrier to help patients overcome so that they can find their voice and feel empowered to participate in their care?
Well, I'd say confidence is certainly the number one emotional feeling that is lacking in some patients. And then the other aspect is permission, that they don't always feel that they're permitted to. And that can be communicated from the medical provider in a lot of different ways. So one of it is just time. There's not enough time in our 15 minutes that we get allotted to see this patient. The other is body language, frankly. We know the doctors that don't know how to sit down in a chair and don't do a proper exam or look at you eye to eye at eye level. And then there's this response to the first tepid question that comes out. One thing that what I'd like to see happen is if we start making this the norm, where patients start to engage, a more deeper level, if this can take off, where this becomes the norm, the doctors will be refreshed by that, we'll say, and learn how to deal with that. But that's going to be a learning experience. And so doctors need to learn how to see a very tepid question, a question that comes with insecurities, and then invite that and nurture that. I'll give you one example real quick. There was a patient of mine, a teenager who had a new heart diagnosis that the outlook was a little bit murky. It was probably going to be okay, but we couldn't be certain. And I only known this family for a few weeks, and the mother sheepishly kind of said, well, we thought about going to this other place for a second opinion. And I looked at her and said, you absolutely should get a second opinion. You've met me 3 weeks ago, and I'm not telling you everything's going to be rosy. And she was going to absolutely the wrong place to get the second opinion, because what's she going to know? She doesn't know who the expert is in this diagnosis. And so we said, yes, 100%, printed out the lab work and directed to the right expert in the area. And she came back happy as a clam, because she could be confident we were doing everything right. There was nothing more to be done. But this idea that you could see someone who's like sort of asking the question, doesn't know what the right question is to ask, and a doctor or a nurse or anybody else on the team can see them and embrace that and say, that's so wonderful that you're asking a lot. Let's sit down and talk about that. That's the other piece that we in the medical community need to provide to families when they start reaching out.
Hearing you've recognized and embraced that vulnerability. You heard a few things that caused you to pause. You talked about the importance of pause. You invited it. And what's just so powerful in our work is that we know in the research that 50 to 70% of patients or their loved ones are fearful of speaking up. So the people that we are most biologically designed to protect, we still have that confidence and permission gap. And what you're leaning into is that vulnerability. And I just think that's so powerful for not just the experience and also quality and safety. And in your role as a parent, how do you make sure that you're protecting your kids?
Yeah, and I can tell you from personal experience that every provider is different. And even as a physician becoming the patient, you feel that some degree of that level of intimidation. And so the idea is to respect the provider, love the provider, appreciate the provider, but also understand that we're just humans helping other humans. Humans helping other humans. I say it all the time. We are trying our best to do a very difficult thing. And when a patient can start to see the doctor in that light, have a little sympathy for that doctor who's just doing the best, and understanding that they're humans, which means that some of them have this personality problem and other people have other personality problems, seeing them as people you would go out on a date with and evaluating them in that way, you'll start to see them as whole persons, and maybe that will help equalize that relationship and then give you permission to interact with them like you would somebody else in your life, that you understand that they're trying, but they actually are struggling sometimes. And so they need family member to come in there and help. And in the series, we talk about making those moments, how to create space for you to jump in, or how to evaluate the doctor where the doctor is. When we talk about safety events and dealing with a safety event, how should we respond when there's a medical error or when there's a bias of some sort? We can kick and scream, and you can certainly do that. But we can also take some other approaches that will get you a better outcome in the long run.
Is there anything we have not talked about today that you think is important to share with our listeners? I know we're eager to have you back to talk more about your new book and just the powerful takeaways to support patients when they're, as a person thrusted into that role and everything's disoriented.
Well, I think to the average patient family, I would just want to express validation that it is really a topsy-turvy world. And when you feel like things are so tumultuous or you have these feelings coming your way, just recognize that, dealing with a serious medical problem really is that difficult. It's not just you, you're not overblowing this. You have permission to feel whatever feelings you have. That's been taught to me by a wonderful nurse, and I take it everywhere I go. You can't act anywhere you want. And so we as providers, want to really counsel our providers to make space and give permission for people to feel that way and remember that they can feel as they feel. And to the patients and families to remember that it's okay when you feel like you're struggling. You don't have to be perfect every time. Aim for imperfection in your life and you'll go much farther. And know that you're not alone, that what you are feeling, many others are too, and there's a way forward.
Dr. Ezon, I've got a question, and I'm intrigued and interested in your answer to the following. Since you've immersed yourself in patient advocacy, how have you become a better doctor? Not only from the empathetic side and the active listening side, but also perhaps from the diagnostic and technical side.
Sure. I think I'm in a particular field fraught with insecurities. By nature of pediatric cardiology, we have, I think, the humility generally, because of the difficulty of the problem faced, to constantly be second guessing or double checking. And I think it only feeds into that more. I am trying to be as cognizant as possible of the different biases or the tendencies to say something's okay when it's not, or to overcall something and not double check. And so that's really, I think, the most critical way it's affected my practice outside of the room with the patient, I would say, is this idea that we keep remembering our fallibility and take that with us at every step, and then try to build systems that can address that. And that is definitely what we do. And in the patient room, it's more of that bluntness, as I say, that I'm just here with you. And this is terrible today. We know that, but we're going to get past that. And reminding, really looking for cues from patients and families of when they need that extra support. I have drastically changed my interaction with the way I interact with patients for whom I give a new diagnosis, in that we dedicate a lot of time now on building resiliency exercises and building resiliency and what can we do for you to engage in self-care and interact in the system in a way that's going to pull you out on the other side of this mess as strong as possible, given the circumstances. that's another goal I think that we really need to incorporate in our care.
All right. Well, I'll let that be the final word from Dr. David Ezon, who's been joining us today on Healthcare Experience Matters. Dr. Ezon is a pediatric cardiologist. He is also an assistant professor of pediatrics. He is the creator of the Patient Empowerment Workshop series, as well as the author of Survive and Conquer, Your Guide When Illness Strikes. We will include a link to that book in the description of today's podcast, so be on the lookout for that. I'll also include other information where you can learn more about what Dr. David Ezon was discussing in today's episode. And I just want to thank everyone for their time today.